UBC, inspiring Uganda.
Qualified, professional, and compassionate doctors talking real solutions to real health problems.
This message is from the Ministry of Health with support from partners.
Good afternoon. I'm Dr. Ssali Grace, and I work in Mulago National Referral Hospital as an ophthalmologist. This is an eye specialist, but I am inclined to work on children mainly. Today on Monday in Mulago Eye Clinic, which is on the 5th floor in New Mulago, this is when we run the clinic for children, and we examine over 150 children in a day. Some are new, some are for follow-up. It's a very busy clinic, and we get referrals from all over the country, different conditions. This is a public hospital, and all of the services are free. We offer free medication. Of course, consultation is free. We have a number of doctors that work here. We have ophthalmic clinic officers. We have optometrists. We have students who are becoming specialists like us, who are doing their masters, and we have students who are going to become doctors. So it is a very busy center. It is a teaching hospital, and we do a lot of work here. And because it's a public hospital, consultations are free, and most of the medications are free of cost. What do the patients need to buy? Mainly the spectacles. Today, I'm here with my colleague. She is an ophthalmic clinic officer, and we work very, very closely with them. They are very, very useful in the communities, because these patients usually come to them first before they come to us, because we have a referral chain, and usually the ophthalmic clinic officers in the field see so many patients, even more than us, because for us, we see the special ones that they can't handle, and she'll tell us more about that.
Good afternoon. My name is Nassanga Samali. I'm an OCO, Ophthalmic Clinic Officer. I'm glad to be here in Mulago. I work with Dr. Ssali, and as she has said, we see a lot of patients out there in the field. We handle a lot of issues concerning eyes, children, trauma, very many issues concerning eyes.
And she's here to upgrade, let me not call it upgrade, but to see what happens in the referral unit, and also to be able to do her treatment and referrals better. So today we are going to see a number of patients. There's a long line waiting out there, and most of the patients that we see are between ages 0 to 18, but even the adults, when they come in, we see them. If I'm to go through the typical day in my clinic, we see a number of school-going children. These children usually have short-sightedness, they have long-sightedness, they have cataracts, they have trauma, they have allergies, allergies which come like in form of itching eyes. They have infections in the eyes, and squints, what we call endali in Uganda. We see younger children who come in much younger. Usually when a child is born and they get trauma during delivery, or they don't cry immediately, what we call birth asphyxia. the brain gets damaged, and when it does, it can affect the visual part of the brain, which we call the visual cortex. That child will come to my clinic when they are not seeing very well, but mainly because of the problems that happened at birth. We also see a number of children who are born as prematures. These children, especially when they're multiple pregnancies, they tend to come out earlier. And those also are born with low birth weight. What we call low birth weight is below 1.5 kilos usually. And these children also come to us with different forms of eye problems, but mainly what we call retinopathy of prematurity, and that may cause blindness. We see a number of cases with increased pressure in the eyes. It's a disease we call glaucoma. And in children, it's really bad because it makes the eyeball get so big, and this child may not be able to see very well because even the front part, which we call the cornea, will become very hazy. It won't be clear. This child is not able to look in light. The eyes keep tearing. And when they come to us early, we can do a lot. We can do surgery, and this child is able to lead a normal life and be able to see very well. We see a lot of children with squints. We call it endali. And at times the squints point inward. We call it esotropia, or point outwards. We call it exotropia. And when we check, we are able to solve what the cause is. At times, if it just needs glasses, we prescribe the glasses. Or if it needs surgery, we do the surgeries. All those children, in a day we could see about 20 of them, as we shall, I think there are some in the line that we shall see later.
Some of the children come with trauma while playing. A fellow child might pierce with a pencil, a knife.
Or playing with sticks.
Playing with sticks. So normally they come with trauma. For us in the field, we handle what we can, and then we refer. We refer to regional referrals or national referral hospitals. And the surgeries are normally done.
Yes,
and the most challenge we normally get when we're in the field there, mothers first try traditional eye medicines. They normally come when they have endeavored to put traditional eye medicines, making the eye worse or the condition worse. And when we refer to national referrals or regional referrals, normally it is very, very hectic and troublesome to bring up that eye to a normal vision, or slightly a vision that can sustain that child. And
at times they may not even have money to come.
Sometimes they don't come. Sometimes they have myths and misconceptions that when you come to hospital, probably your eye will get blind.
Yes.
Others even don't like glasses. You prescribe glasses, they don't want to put them on. But it will make their eyes more to fail completely. And those are the challenges sometimes we get. And we have to endeavor to convince these mothers or children or any person that comes in.
Out there, most people think that the first thing you do when you have an eye problem is to put tea leaves, to put salt, to put urine, to put everything before you come to hospital. But also because they may not have money to come to the hospitals. At times it's too far. At times they have a fear of big hospitals. At times they've not been to Kampala or to big cities. So when they get here, we operate on them if they have, say, trauma. Of course, in Mulago, it's all free of charge. And we see a lot of children, because they are not fed well or not immunized, they come malnourished or get things like measles, vitamin A deficiencies. And this is because maybe they didn't get their vitamin A dose or didn't get their full immunizations. And we appeal to mothers to breastfeed and to go for proper full immunization.
And even antenatal care, mothers should go for antenatal care. So that some of the problems are identified early as you're pregnant.
We are here to cause awareness about eye care in children, that the earlier you come in for treatment and management, the better for the child, the better outcome. And here in Mulago, everything is free of charge. If there is some medicine which may not be in the pharmacy, you may buy, but everything else, even the surgeries, are free.
This message is from the Ministry of Health with support from partners.
You are watching the DOCtalk show.
Amanya gange nze Namutebi Sharon nga nkolera wano wennyini Saka Kirombe oba Makindye. Empangula gye nawanguddemu ssente mbadde nga nkozesa mobile money nga nsindika school fees w'omwana ku ssomero. Okutegeera nti mpangudde, nze mutima neegambye nti kambalinde bamale okujja ndyoke nzikirize nti mpangudde. Kyennyinza okubagamba nti si byabafere, weewaawo abafere gye bali, naye ennamba eri emu yokka era bw'eba ekukubidde omanye eyo si yabafere. Mpulira bulungi nnyo era ndi musanyufu nnyo. Naye MTN mobile money mbebaza nnyo, mwebale nnyo, mwebalire.
Together, we're unstoppable.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Welcome back to the DOCtalk show. Before the break, we were talking about eye conditions in children, as seen here in the Mulago National Referral Hospital Pediatric Eye Clinic, which we usually run on Mondays. And now we are going to interact with the patients, or bring the patients into the clinic so that we can see them, treat them, advise them, and recommend whatever treatment that we need to do, and send them to the theaters for the surgeries.
Earlier on, when it is bright, yes, she couldn't see. If you carry her on your shoulder, there's a way she fixes her eyes under your armpit. She hides. For us, we thought that she was having too much sleep. We were saying, oh, this one has too much sleep.
Yes.
That's what we were
at that time.
At that time. Till when you go inside, she opened big eyes, seeing clearly. You start admiring that the eyes are looking good, yes, but why is she having too much sleep? Yes. So that's when they told us, no, you first try. So from Ginger, they sent us here.
Yes. So you came from Ginger, the referral hospital? Yes. So we get referrals from so many hospitals. Victoria came a year ago. So that is a good thing. When they come early, we solve their problems much faster, and the outcome is usually better. The problem at that time, the child could not see light. The child had pain when looking at light. And when we did the tests, we found that there was increased pressure in the eyes. A condition we call glaucoma, an increase in pressure in the eyes. It can be in children, it can be in adults. Problem if it happens in children and we don't act quickly, it causes a lot of complications in the eyes. The child can end up blind. The mother brought the child very early, at 2 months of age. We've been managing, we did surgery, and the pressure, which was about 40 in that eye, is now 10. The normal pressure in an eye should not exceed 20. Imagine this pressure was 48, it was very, very high, and it would have caused blindness if the mother had come late. We are happy they came early. We did surgery. As you can see, the child can see very well, is active, is playing, and the pressures have reduced. And the message here is that children can also have pressure in the eyes, and usually it comes with the eyes, they become bigger. So if you see a child with big eyes, don't think it's just beautiful. Send them to us and we check, because it could be pressure in the eyes. And most of the medicines are offered in the pharmacy free of charge. So she's going to go to the pharmacy and pick the medicines. We shall see the child again after 1 month. Mugera is 8 months old and has come in with red eyes. These eyes are red and they have a discharge, what we call a binyinyi in Luganda. And the mother says it's been for 4 days. Nakunya. What do you take much? She hadn't. Good thing is that she hasn't applied any medications. We've been having this red eye epidemic. It happens in children, it happens in adults. And The problem that we've been getting with this red eye epidemic is that they come in after using so many medicines and traditional eye medications and even some home remedies. They put urine on the eyes, they put tea leaves, they put salt, at times even breast milk, they pour on the eyes. So this is good that she has come early. That means that when we give treatment, most likely we shall have a good outcome. So we are going to prescribe some medicines. The good thing, the medicines here are free of charge in our pharmacy. So we are going to write the prescription and she goes and picks some.
Ate, like sometimes abera tayagala kutunula mu kitangala why?
Anti malwadde. Obulwadde buli bwe buleese okumyuka n'ebinyinyi ebyo. Kati katumuwe eddagala.
This message is from the Ministry of Health with support from partners.
You are watching the DOCtalk show.
Gold. We all want it. That soft yellow glow of a subdued sun in your hands. That precious polish of elegance. To hold it is one thing, but to taste it is everything else. Relish the satisfying taste of a beer, unmatched in quality, unmatched in consistency, and with 23 Global Gold Awards. A beer unmatched in gold.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
This is where we see children from who have eye problems. And I mainly deal with the children's eye problems. And today I have with me Divine Mulungi, who is a 5-year-old child, was born a twin and with low birth weight.
Thank you, Doctor. My name is Maureen Tucker. I'm a mother of 5. I have 5 children and have 2 pairs of twins. This is my first pair, and she's the young one, and she had low birth weight. She was 1.5. Then the other twin was 2.3. So we didn't realize it at first until last year. I believe by the time of COVID, they used so much to stay indoors, and they could be on TV, on. So in that period, we realized she could block the friends, especially when they are watching the TV. The TV and then also the phone. She could draw closer, and we were wondering why she could do that. But till last year when they had started school, and I think they were in middle class, so the teacher started complaining the girl does not concentrate in class, she does not focus. So we were like, I think she has a problem with her eyes. So that's when we called Dr. Mercy. She works here and she directed us to come here, but we could fear that, those things are expensive. Yes. Eye issues are so expensive, so we could fear, and we were like, okay, let's first accumulate some money. We tried to find out from Mengo. They told us it was 1 M. So
1 million?
Yes, 1 million.
Yes.
So how can we now go about this? So we tried to go to Georgia. There's an eye clinic called
Georgina, yes.
Georgina, right, thank you. So we tried to go there, and they tested them. They told us the baby has a problem, but they told us also a high cost.
Yes.
So we opted to come to Mulago, where maybe we could find some treatment. So when we came here, the reception was good, and we had to pay for the spectacles, and she has improved. She could concentrate now. She concentrates in class. She focuses on the blackboard, and the teachers told us there's a great improvement
in the performance. Yes.
Ever since we got her the spectacles.
That is very good. Yes.
The challenges we found with her is that the plays she breaks.
They break. Yes.
It has been a lot of training like train her on how she puts them on,
Yes.
how to clean them. At times she forgets them in the house and she runs
to school without
Yes.
them. Yes.
So I have to go back and refine them for her.
Yes.
Probably that's the journey. Yes.
And usually twins or multiple pregnancies or multiple deliveries and with low birth weight tend to get eye problems, mainly because they put them on oxygen because of the many other issues they tend to have, and that causes a problem on the back of the eye that we call the retina, and that can cause us eye complications. So Divine is one of those who does not see very well, especially the distance objects, and now she has started school and is not able to see very well in school. So we've given her a pair of glasses and she sees much better and can easily interact with the parents and play and see better in school. Children with eye problems should come to us quite early because the brain is also developing, and when they come in late, then we get issues with improving their sight. So that is what happened with Divine. They came in at 5 years of age. To us, that is a bit late because the brain develops as soon as the child starts developing and as soon as the child is born. And right now she sees better with the glasses, but not optimal vision because they didn't come early enough. So the message here is that as soon as you notice a child with poor vision at home, please come in early so that we can solve these problems so that the brain can develop and then we get optimum vision. It's also okay for children to put on glasses. As you can see, Divine is very happy with her pair of spectacles, and it's very okay for a child to put on spectacles because we see most mothers don't give their children spectacles even when we prescribe them because they think children should not wear spectacles. Children play, so they break these spectacles quite often and they come in to replace them. We can't stop them from playing. As you can see, the child is very playful. Even here, we give them toys to play with because they're children. They've been here since morning and they get tired. So we are going to replace her pair of spectacles. And also as they grow, the size of the spectacles becomes smaller. So we are here to do that. We have done the measurements and we don't need to change the lenses of the spectacles. We are going to change the frame. As you can see, we are tying it with black rubber band and we need another pair. It's very expensive. The mothers usually can't afford this change of spectacles, but for children, that's what happens. They play and they break them and we need to change them often. Also because the children are growing, the numbers in the lenses are changing. So I'm going to prescribe the spectacles and the mother will have to foot the cost of the spectacles. So I have another child here with me who has come mainly because of the squints. In Uganda we call it endali. The child's eyes do not look straight ahead. Mama, kiki ekisinga okweraliikiriza? Gakoze gatya? Gabadde ki? Engeri gye gatunulamu. Wamuzaala bw'otya? Tewamwetegereza? Wakiraba ddi?
Namulaba akuze.
Ng'alina emyezi emeka?
Kale omwana watandikira okutunula naye nga waba atunula kino ekya bbulaka kidda muno.
Nga kidda munda. Olabawo enjawulo kati bw'agenda akula oba kyeyongera bweyongezi?
Kyeyongera bweyongezi.
Tuyinza okuba nga tulina okugalongoosa, nakyo tujja kikubuulira nga tumaze okukola test zino. The child is 1 year old and since she was born has had those squints. As you can see, the eyes are not looking straight. Although the child sees the objects, but the eyes are not straight. Sometimes that happens and children are born with squints, what we call endali, and we are able to help them. When they come to the hospital, there are some tests that we do and we check and see what the problem is. And at times they are either very short-sighted or very long-sighted, or they have what we call cataracts. and depending on what we find, we treat that. So the message here is that if a child is born with eyes looking like this, what we call indali, they should come in early because the brain is developing. If we delay, it may become too late for us to help improve, especially the vision of the child. We can do surgery and correct these eyes, and usually the mothers are happy after that because the eyes are straight. When the child goes to school, they are not laughed at, because we find that elder children don't even perform well in school because they are laughed at because the eyes are not looking well. And the message here is that these children should come to us and we help them. If it's early enough, like her, the outcome is better than if they come later. So that's why the mother is here. It's her first time. So we are going to do the tests and then see what to do with the child.
This message is from the Ministry of Health with support from partners.
You are watching the DOCtalk show.
Radio 7 masindika bulijjo egenda kujjaganya emyaka esatu mu nsike nga 3/8 mu kisaawe ky'e Masindi ati Lwatamabaale.
Hey, what's up? This is Eddie Kenz. We're celebrating a Radio 7. Yakamala emyaka esatu ng'etuweereza Lwatamabaale Masindi mu kisaawe. Come, let's celebrate.
Lwatamabaale sobodonkoni nga bulijjo nga bw'okimanyi ebyokulya n'ebyokunywa byonna bya bwerere ate kuletedde abayimbi ab'amaanyi Eddie Kenzo ne Big Talent yonna lukoba ku lukoba kwekata n'abayimbi b'e Munyoro bonna tutandika ku makya tukiggalawo ku makya g'enkeera okuyingira mu mutwalo gumu gwokka jangu onyenye gali b'enjole mu Lwatamabaale anti nga Radio 7 ejjaganya emyaka esatu mu kisaawe e Masindi nga 3/8 tusookawo n'ebyemizannyo omuli omupiira okubaka okudduka nga biwagiddwa Kijana Sugar Wax Now Brothers Palam Sounds Baitu Group.
Everywhere you go, MTN.
Predict the outcome of 10 football games and win big with tickets at only 500 shillings. Play for this Monday's draw to stand a chance to win big with Sports Stake 10.
Buy your tickets at authorized shops on nationallottery.go.ug to download the app or simply dial *278#.
Ugandan National Lottery. Dream, play, win.
Participants must be 18 years or older. Play responsibly. The Uganda National Lottery is operated by Ituba, Uganda and regulated by the National Lotteries and Gaming Regulatory Board.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Welcome back from the break. This is the DOCtalk show, and we are continuing with the childhood eye diseases as seen in the Mulago National Referral Hospital. As we've seen, some of the cases that we see in the clinic, there are quite a number, varied age groups. They come in with their caretakers. At times they don't have parents, they come in with grandparents, and we recommend what we have to recommend and send them to the theaters. Some of these children come in with cancers of the eye, and this usually is seen by the mothers first. This is a disease mainly we call retinoblastoma, and the mother will come with a complaint saying that the child's eye glows, especially in the night. This is not a very good disease because it can cause death of the child. It's a malignant tumor of the eye. And when the child comes in, we usually work very closely with the Cancer Institute, and we give chemotherapy. If the child comes in late, then we may have to remove the child's eye and to prevent death of the child, because if it's still confined in the eyeball, the child's life may be saved. So our colleagues in the community usually know that when a child has something white in the pupil of the eye, it could be a cancer. It could be a cataract, but it can also be a cancer. So they quickly refer these patients to us for quick treatment, because if we delay, this child can die because of the cancer. We have many other cancers of the eye, but usually what happens very early on is what we call a retinoblastoma. Now we are going to see how we can prevent all these diseases, these eye diseases in the children, and prevent all this suffering in the children as we have seen today.
And to add on what Doctor was saying about retinoblastoma, we urge mothers to come immediately they see that white thing in the pupil. Immediately they see it. Don't wait. Don't use any remedy. You come immediately so that they work upon it before it spreads to other parts of the body or to the brain. And for the prevention, the only prevention of retinoblastoma is to come early to hospital as soon as you see that white thing in the pupil. Normally, sometimes it's like a cat's eye at night. It glitters and shines like a cat. And there are some other infections, some other eye infections that you can prevent as far as prevention is concerned. Basically hygiene, because we start with the lowest. Hygiene, every mother at home, everybody at home can as well put his or her hygiene to the standard that is recommended. Hand washing is part of the hygiene with clean water and soap. Like for some areas, there is trachoma, whereby you have to dispose your waste disposal should be properly done. Hand washing with clean water. Eat good food, eat fruits, eat vitamins. Mothers out there in the villages can afford this. And even toilets, use of toilets. There are some areas where I find that they don't dispose their wastes in the toilets, which may also cause trachoma. And regular eye checkup is one of the prevention. Regularly come for the eye checkup. Don't wait for the disease to get you and then you come rushing. You might come rushing when you're already blind. So we urge you to at least keep in touch with us. Come to us. We are freely. We are very calm. We are very lovely. You can come and we teach you.
Thank you very much. The message here today is that children should be managed early, because as they grow, the brain is developing, and if we don't manage their problems early enough, they get what we call lazy eyes, and we can't treat them later. So the message is, if you see anything in a child's eye that you are worried about, please come to the hospital. It is okay for a child to wear glasses. It's okay for a child to have surgery if they need it. And don't fear. Don't listen to other people more than you listen to the doctors. Some diseases run in families. If you have diseases like increased pressure in your eyes, please bring your children early so that we check. If you have one of the child with increased pressure in the eyes, then bring the others early for check. That can also help us prevent a lot of complications. If you wear glasses and a child is in class, is saying that they don't see on the chalkboard, just know that some of these diseases like short sight are passed on genetically, and that child may have short sight and can wear glasses and be able to perform well in school. So we want to stop all the misnomers of thinking that children don't wear glasses, because if we don't do that, the eyes and the brain become lazy and we can't sort it out later on.
Self-medication is also a problem out there. Mothers normally treat their children with steroids. They go to any drug shop, prescribe for themselves drugs, use steroids. Those steroids sometimes have a complication as their own. So we urge you, if you have any eye problem or eye condition, please come and see the eye specialists before you prescribe or you do self-medication.
Thank you very much. We are open on Mondays in Mulago National Referral Hospitals to treat your children's eye diseases. Come in. We don't ask for money to see your child. And if the medicines are available, we offer them, and the surgeries are free of cost. Thank you very much. I'm Dr. Ssali, pediatric ophthalmologist, Mulago National Referral Hospital.
I'm Nassanga Samali, an OCO. Nice to be with you, and thank you, viewers.
This has been the DOCtalk show. Please follow us on our social media handles. Thank you very much. Have a good night.
This message is from the Ministry of Health with support from partners.
UBC, inspiring Uganda.
One-on-one with Michael Jordan Lukomwa.
A weekly face-to-face conversation focusing on accountability, inspiration, information, and sensitization of the public from the various sources such as inspirational profiles.
Having a disability is not inability.
Professional guidance.
There is no special antiretroviral therapy that is given specifically for discordant couples.
And of course, politics.
Don't you see anywhere that you would give a credit in the fight against COVID?
My role as the owner of the country is not to, be preoccupied by giving credit to my servant.
We have said that if we are to talk to General Museveni, there must be certain conditions in place.
Is it true that you paid 5 million shillings to MPs that voted for Anita Monga and Talebo?
That is laughable. Why would we pay when we have nominated them as SEC?
Every party has been represented in Uganda's parliament for 10 years. We only by one MP, you yourself and my daughter, Susan.
Every Friday 9 p.m. it's One-on-One with Michael Jordan Lukomwa on UBC TV, inspiring Uganda.